Hi, I'm Dr. Amy Rolfsen. I'm part of the clinical team here at Diagnostic Solutions Lab. I want to talk to you today about retesting guidelines for the GI map stool test. So say you have a test that comes back looking like you may need to do some work with antimicrobials or antibiotics or antifungals. So you may have an H. pylori growth pattern. Maybe you've got page 3 dysbiotic organisms, maybe you've got candida showing up or a parasite, and you're wanting to use, say, a 2-month natural protocol to bring those organisms down. You would treat for 2 months, wait 1 month, and retest. Now, if you're using pharmaceuticals, maybe your protocol would be 2 weeks, a month long. Still, once that's done, you wait 1 month to repeat the test. If your patient's test comes back and it looks like what you need to do is support normal flora, support the gut lining, support digestion, support overall vitality, you may want to do that protocol for about 6 months, maybe longer. Some people need this very persistently. The suggestion for retest there may be in the 6 to 9 month range. Now, some people also ask me, if my patient is feeling 10 times better after treatment is finished, do I have to retest? I think there is value in retesting to see if things like blastocystis hominis or diatomeba fragilis or candida have come down to either levels that are acceptable or below detection limit. But you don't necessarily need to do so in terms of safety. So if your patient is feeling great, they do not want to retest, you don't need to. There are 3 findings on GI map that I would feel the need in my practice to run a retest for, and that would be page 1 pathogens. If pathogens show up on page 1, I am definitely retesting to make sure they are gone. Sometimes even at low levels, people are asymptomatic, but it can still be problematic. The 2 other markers that I would always be retesting for would be if on page 4, fecal occult blood or calprotectin showed up high out of range. Those are our medical red flag findings and should always be repeated if they're abnormal. I hope this has been helpful. We're doing a series on answering clinical questions, so if you have a burning clinical question, comment below and we'll do our best to get to it. Thanks for listening.